Before we get started, just a quick note that this video is for general information only and isn't a substitute for advice from your own healthcare professional. Have you heard that electrolyte drinks might help with fatty liver disease? It's a question we get asked a lot, and the honest answer might surprise you. Fatty liver disease is incredibly common. Around 1 in 3 adults in the UK are affected by it, so it's no wonder people are looking for ways to support their liver health. With electrolyte drinks and supplements everywhere right now, it's natural to wonder whether they might help. So let's talk about what electrolytes actually are. They're minerals, things like sodium, potassium, and magnesium, and they play genuinely important roles in your body. They help regulate fluid balance, support nerve function, and keep your cells working properly. But here's the thing. Being essential for the body in general doesn't mean they directly treat fatty liver disease. Fatty liver disease, or hepatic steatosis, happens when excess fat builds up in liver cells. Your liver does an enormous amount of work, metabolizing nutrients, filtering toxins, producing proteins. When fat accumulates beyond a certain point, those functions can start to be affected. And in the early stages, many people have no symptoms at all, which is part of what makes it so tricky. Now, when it comes to electrolytes and fatty liver, the evidence is pretty clear. In people with uncomplicated fatty liver disease, electrolyte levels are typically normal. And if your levels are already normal, supplementing with electrolytes doesn't appear to provide any therapeutic benefit for the liver condition itself. It's also worth knowing that many commercial electrolyte drinks contain quite a lot of added sugar, which can actually worsen fat accumulation in the liver and make weight management harder. That's the opposite of what you're trying to achieve. And some electrolyte drinks are also high in sodium, which may be unsuitable if you have high blood pressure, so it's worth checking the label carefully. Electrolyte imbalances do become medically relevant in advanced liver disease, specifically in decompensated cirrhosis. But at that stage, electrolyte management needs to happen under close medical supervision. It's not something to self-manage with over-the-counter supplements. So, what does the evidence actually support for fatty liver? The good news is that it's often reversible through lifestyle changes. NICE guidelines highlight that meaningful weight loss can significantly reduce liver fat and, in more advanced cases, improve liver inflammation. A Mediterranean-style diet rich in vegetables, whole grains, legumes, fish, and healthy fats is one of the most well-supported approaches. Regular physical activity also plays an important role, as does managing associated conditions like type 2 diabetes or high blood pressure. If you're thinking about making changes to support your liver health, it's really worth having a conversation with your doctor. They can assess where you're at and help you put together a plan that's right for you. If you're considering potassium or magnesium supplements in particular, please speak to a healthcare professional before starting them, especially if you have kidney disease or take blood pressure medicines, as there can be real risks and interactions involved. For further information, the NHS website and the British Liver Trust are both excellent UK resources on fatty liver disease. And if you're experiencing symptoms like persistent fatigue or discomfort in your upper right abdomen, don't put off speaking to your GP. Early assessment makes a real difference. So to recap, electrolytes are important for your body, but the evidence does not support using electrolyte supplements to treat fatty liver disease. Many electrolyte drinks contain sugar or sodium that could actually make things worse. The approaches with the strongest evidence are weight management, a Mediterranean-style diet, and staying active, ideally guided by your healthcare team. Remember, this video is for general information only. Always speak to your own healthcare professional for advice tailored to you. If you found this helpful, let us know in the comments. Give this video a like if it was useful, and subscribe to the Bolt Pharmacy channel so you don't miss what's coming next.